Hi everyone, I'm Dr. Natalie and I've recently joined the North Shore medical team. I'm originally from London and I'm board certified in general practice and family medicine, and I have an interest in lifestyle and preventative medicine, and I'm really pleased to be joined by Dr. Flood.
Hello everyone, I am Dr. Amani Flood Robinson. I am a board certified doctor of naturopathic medicine with a focus on preventive care, naturopathic therapies, and also lifestyle changes. I manage chronic disease, weight loss, and a number of other health concerns.
So we're here to talk about various different issues and interesting topics related to women's health. So we'll be covering the importance of women's health, regular checkups and screenings, as well as advice on how we can improve our lifestyles to maintain our health.
So we're here to talk about empowering women to take charge of their health.
Yeah.
And it's a really exciting topic. You know, women's health has not always been at the forefront of medicine, isn't it?
Definitely. And it's good that with the advances in technology and just more awareness about the importance of women's health and women just speaking up for themselves generally, there's more knowledge and information out there on how we can improve ourselves to live longer and healthier.
Yeah, and women's bodies and women's health concerns are really unique. There was a time when women were just thought of as a man in a dress or
Literally.
men with wounds.
Literally.
And all of the research, centered around that 40-year-old male.
Yeah.
Leaving off all of our hormonal considerations and other genetic factors that make women special.
Definitely, and our own unique lifestyles as well. So now in 21st century life, women are often juggling careers as well as home life as well. So often that's put above their own health. So we just want to encourage women to put their health first. Easier said than done. But
easier said than done, but so necessary.
Exactly.
So got to do it, ladies.
Exactly.
All right. Some of the topics that we hope to cover today are such as the importance of preventive care. Both of us are keenly concerned with preventive health because prevention is worth a pound of cure.
Definitely.
Better outcomes with preventive care.
Yeah.
Right?
Yeah, definitely.
So we're going to talk about the lifestyle of prevention. Some other topics we're going to include are screenings.
Yeah.
Health screenings, yeah.
So
what
they are exactly, and the different screenings that are available for women and how often they should have them.
Exactly.
And when there are times they should have it more frequently than.
And they're unique to women.
Exactly. Exactly.
Yeah. So we're also going to talk about nutrition and food as medicine. We're going to talk about breast cancer awareness and education, of course.
Which is very topical at the moment.
Yeah. Exactly.
Yeah.
Then we'll talk about supplements and botanicals. So many people are hoping to transition to natural healthcare and natural medicine and natural remedies. So we're definitely going to cover that.
Definitely. And just the general myths and misconceptions that are out there about women's health. We want to try and dispel those and make women more comfortable to come to us about any concerns that they have and try and break that stigma that exists.
Absolutely. So many myths and misconceptions. So we really want to. And it's putting people's health at risk, both women and men, really.
Yeah.
So we want to know when to see a doctor and what to expect at a healthcare check for women.
Yeah, so what we'll go through with you, and also these checks are a safe space for women to come in with anything that's on their minds that they might feel uncomfortable talking to other people about, and we want to try and make sure they're assessed properly and promptly.
That's really good. Then I'll talk about what to expect at a naturopathic health visit, which is a really unique setting, and many people find it really, really helpful because there's a little more time involved, a little more interaction with the patient than what unfortunately doctors often have in the typical clinical setting.
Yeah, and you have a wealth of experience and expertise to share with patients, so I'd really encourage patients to book in and learn from you and see how they can improve their lifestyles with you.
Yeah, 10 years of practicing. So we're going to finish up with a call to action and show women exactly the way forward with healthcare, health prevention, and overall better outcomes.
Exactly.
So we're so glad you tuned in.
And we're happy to start this and just to share our information and knowledge with you. So I'll just say a bit more about women's health and the importance of preventative care.
Okay.
So as we all know, prevention is better than cure. And even though you may feel well and healthy and are managing to juggle the various responsibilities that you have, it's still important to come for your regular checkups, because there are certain conditions that can only really be checked once we do the test or look into it further. So the earlier you come in, usually the more we can do about anything that we may find.
Exactly. And you know what else that people don't think about so much is that baseline. So come in while you're healthy. We can see what your healthy body looks like and acts like. Then when something changes, it stands out more, doesn't it?
Exactly. You need to know what's normal.
What's normal.
And what's normal for you, because everybody has their own normal.
Exactly.
So we're here to help you establish that, so that you have those numbers in mind, you know what your blood pressure is, your cholesterol is, as well as the specific women's health checks that we're going to go through.
So important. We really, when it comes to changing the mindset of women to prioritize, what are some of the things that women should think about as they're considering all the various things they're juggling?
Yeah, so as we mentioned earlier, especially in 21st century world, women are often juggling their careers with their home life, and also other responsibilities. Caring for older parents is also more common, and we all know that Bermuda is also very expensive, so the financial aspect of things is also on women's mind as well. But what I really want to emphasize is, if you notice any changes in yourself, even though you have all those various responsibilities, try not to put it aside. Easier said than done, but really try and make that time to come and see us, so that we can look into it and put your mind at ease, or do any further tests if you need it.
Put your mind at ease. That's one thing off your plate, like not worrying about your health. And with women, right now we're in the sandwich generation, so they say, and so it's generally often the woman who's caring for the elderly parents and the children, maybe even some grandchildren. So it's a lot. And if you're caring for others and they're depending on you, well, it's even more important, isn't it, that you stay strong, that you stay healthy, because who's going to take up that slack if you're not able to do it?
That's true, and there are many superwomen out there that are juggling so much, but we want to make sure you're a healthy superwoman too, so that you can carry that cape with pride. So please come and see us if anything comes to mind.
Exactly. All right, so lifestyle and prevention. Should we move into that topic? Because my goodness.
Definitely.
Yeah, it's all in the papers. It's all in the social media.
Yeah, definitely social media, which we're going to touch upon. But could you just talk a bit more about the daily habits that patients or women can do to improve their health?
Yes, absolutely. And consistency is the key. Daily habits is really the key. So once we begin to learn these concepts of health, we want to practice it on a daily basis until it becomes second nature. Right? So that every day you're drinking water, every day you're getting adequate sleep, every day your meals are full of healthy fruits, vegetables, whole grains, and healthy fats, and absent of the things that we don't need that are going to deteriorate our health every day. Never smoking cigarettes, never over consuming alcohol, recreational drugs, and things like that.
And can you touch a bit more on the importance of sleep?
Sleep is so critical. Everyone loves a good night's sleep. But do they know a good night's sleep loves you right back? So much occurs in our body when we sleep. Our conscious mind is shut down, and it's an opportunity for our processes to be in the background. We do health surveillance. Cancer surveillance occurs when our body is able to check in on itself. The liver detoxification that people are so interested in, it takes place when we're sleeping, when we're not digesting food and so aware of the outside world. So sleep is really critical for a healthy mood, keep our memories safe. Can you think of something more to add?
Yeah, to add with the memory, it also helps to process the events that have gone on throughout the day. So your brain is basically sifting through what is the most important thing that happened and what is the least important thing that happened. So, a conversation that really wasn't that important, your brain will try and sweep that out of the way and then reinforce the more important memories.
Isn't that interesting? So sleep is really critical. How much sleep does the average adult woman sort of need? I mean, certainly 8 hours is the average amount that people need to sleep. If you get less than that, there may be a bodily function that takes place between 12 midnight and 1 a.m. And if you're not asleep, your body cannot carry out that function as effectively as it would if you were asleep.
Exactly. And alongside the 8 hours, quality of sleep is also as important as quantity.
Oh, my goodness.
We want to make sure you're waking up feeling refreshed, you're feeling rested, and not having interruptions throughout the night as well. So Dr. Flood, could you say a bit more about what people can do to try and de-stimulate and have a better quality night's sleep?
You said it, de-stimulate. You know, there's so many things in our daily life that attract and hold our attention.
Yeah.
But unfortunately, if we carry all of those thoughts and actions into the evening time, it's going to be more difficult to get restful sleep, as you said. So we want to have good sleep hygiene. This is where we start winding down long before bedtime, at least an hour or two before bedtime. We want to wind down, don't we? And get ready for bed with that sleep hygiene. So no overstimulating videos or conversations about how to solve the world's
that
problems.
can wait till the morning.
Lay down with that in your head and then try to sleep. You want to sleep in a cool, dark room. A lot of times we pile on comfy covers and then kick them off throughout the night, right? So our bodies cool down when we sleep. The muscles cool down, and so it's a good time to make sure that the temperature in the room is right for sleep.
Yeah, definitely. That's all very important, because a good night's sleep leads to a good day the day ahead.
Next day.
So it's good
Don't drink too much water before going to bed, especially ladies, men too.
Yeah.
But we're talking about women's health, and so many women have some continence issues with urine, right?
That's quite
so if you guzzle a lot of water trying to make up for that daily amount just before bed, prepare for a couple of nighttime trips to the to the loo, isn't it?
It's true.
Yeah.
And also touching on fluids, caffeine is also important. So not to drink any caffeine after midday is ideal, because that can still have effects later on at night.
It's so true.
I know the super women are trying to push through the day, but that caffeine, that late afternoon coffee can impact your sleep. So it's best to not have it after midday.
That's a good point, yeah. And just too much caffeine, period. So limit that coffee if you want to have good rest. A lot of people come to us and they can't sleep. When we start investigating what may be going wrong, some pretty obvious things come up that they just sort of missed.
Yeah, like the 8 cups of coffee that you had.
That you had in the morning. But still lingering.
Definitely. Okay.
You know what is really excellent for getting healthy sleep is a nutritional product called ashwagandha. Yeah, so cortisol hormone is the one that keeps us a bit agitated. It's the hormone that gets us through those stressful times throughout the day. And we need to sort of decompress from all of that cortisol and actually detox it. So ashwagandha is one of the premier herbs and herbal products that is used to help heal up those adrenal glands that produce all that cortisol, such as the Dr. Brown's Lab ashwagandha gummies.
That's really good to mention, and that actually moves on to our next point. Could you talk about how patients can manage stress generally?
The general management of stress, yes, there are a lot of things. I think you were telling me earlier about the breathing pattern of 4-7-8.
Correct.
Tell us about that.
Yeah, I'm happy to. So the 4-7-8 breathing method is when people are advised to take a deep breath in and hold for 4 seconds, or deep breath in for 4 seconds, hold for 7 seconds, and then exhale over 8 seconds. It's easier said than done. It might just sound like it's just 7 seconds, but it takes some training. Yeah. But the way that it works is that people then focus on their breathing, which distracts them from their problems, and it also activates the vagus nerve, which is part of the rest and digest, or what we call the parasympathetic nervous system. So we want to activate that rather than the fight and flight system that is linked to stress.
That's probably really unique to women too, because we are more hormonally influenced, isn't it? And when there are stressful events that bother us, and we really are solution orientated as well, that can really play on your mind and just elevate that cortisol. So sometimes when we're in the midst of that stressful moment, stop what you're doing and take that breathing break. 1 minute, 2 minutes, 3 minutes. You'll be surprised how calm you can feel after that. Just like that. What do they call it? Woo-saw. Breathe in, breathe out, refocus your thoughts.
Yeah.
And guess what? The answers are going to be more readily available to you in that mode rather than when you're super hyped, isn't it?
Of course. And you made a key point about taking a few minutes. A lot of people feel like they can only relax when they go on holiday.
Right.
But the main way to de-stress is to take few moments throughout the day rather than waiting until the end of the day when you've already experienced so much stress. So you can take short 5-minute breaks throughout the day, and that's still as effective and gives your brain and your body a chance just to rest and to de-stress a little bit before you go back to that situation.
Yeah, because we really can't talk ourselves into relaxing. We have to literally relax.
Yeah.
And then the body picks up that signal, isn't it?
Exactly, that's so true.
Okay, so yeah, the Dr. Brown's ashwagandha gummies are helpful for sleep and releasing cortisol, stress management.
Good to know.
Okay, good. So you know what? Realistic goals is an important part of figuring out just how to live that balanced lifestyle, isn't it? Smart goals?
Smart goals, yeah. So ensuring that the goals are specific, that they're measurable,
right,
achievable, and also relevant to your overall well-being, and also time-bound as well, because you don't want something to be achieved in like 5 years' time. You want it to be a bit more realistic.
Yes, exactly. The difference between a dream and a goal is whether or not it's actually doable, isn't it?
Exactly.
So goals without specifics are really just dreams. Nothing wrong with dreams, but when you want to achieve something, you need that sense of success once you've accomplished it.
Exactly. And this will be a good point to mention that obviously when it comes to managing weight, you're able to work with patients in order to have more practical ways of changing their diet to meet their goals, and also Alex, our health coach, can also help with that as well.
Exactly.
So breaking the goals down to make it achievable.
That's right. Exactly. That is such a good point. Particularly in our weight loss clinics, we really walk hand in hand with our patients, because there's nothing more frustrating than making what you consider to be dietary changes and not losing that weight. You get so discouraged. So having those goals, even in the area of a specific health concern, is really critical. Yeah, good.
And a lot of patients, they have the motivation, they just need more advice and more coaching in order to reach those goals. So that's what we're here to do.
Exactly. So Dr. Natalie, talk to us a little bit more about screening and what it's all about.
Of course. So screening is generally a medical test that is given to people who feel well and are healthy, but it's meant to be a way to detect any changes in the body that could be linked to a more serious health condition before it becomes a problem. So specifically for women, that would be pap smears and mammograms. So I'm just going to talk a bit more about each of them. So pap smears generally start from the age of 21, and from the ages of 21 to 29, women generally have it every 3 years. And then assuming the last pap smear is normal, from the age of 30, they can then go on to have every 5 years until the age of 65. And the pap smear looks at the cells at the neck of the womb and also tests for HPV, which is an infection. And the reason why we do these tests is to look for any early changes that could indicate cervical cancer, which is the cancer at the neck of the womb. So we advise women to have those tests regularly and to keep to the schedule. And the other screening test is the mammogram, which many women will also be familiar with. And that uses low-grade radiation to look at the breast and detect any lumps that the woman might not be able to feel. So that's the point, that the mammogram can detect it to see if any further tests are needed as well. So that starts from age 40. And generally until the age of 54, we advise women to have it every year. And then assuming that the most recent mammogram is normal, from age 55, they can continue to have it every year or switch to every other year. But you can always discuss with your doctor to decide what to do. And as with all screening tests, it's always specific to the person. So people who are of higher risk, maybe if you have a relative that has any of those conditions, then they're normally invited to either start earlier or to have it more frequently. So just make sure you have a chat with your doctor about it.
Really, that's some really good information. Yeah. And it's all available on a one-to-one conversation when you come for your well woman exam and things like that.
Exactly.
So you don't have to memorize all of that, because it's a lot of good information and it's important.
Yeah.
So being in the hands of your trusted healthcare provider, like yourself,
Thank you.
someone who's knowledgeable and really familiar as part of your general practice with women's healthcare and all those screenings.
Definitely. And if you can't, as we advise, to come for your annual physical health check, we will check with you to see when you're next due your pap smear or mammogram as well, and make sure that you're up to date with it.
So some people like to have a gynae doctor as well as a GP, but GPs are perfectly equipped to do these screenings as well. Isn't that right?
And that's a good point to mention. And we can also do pap smears here. So if for any reason you're unable to reach your gynecologist, you can always come to us. I would advise for you to make a note of when you had your last pap smear, just so that you can keep a record of it.
That is why North Shore Medical really is a one-stop shop for healthcare. Is that we have all of those services widely available to our patients.
Definitely.
That's really good. It's one thing that people often comment that they like about us. And it makes me proud too.
Definitely.
I love being part of that team.
Yes.
So there's so much the importance of that individualized screening to find those red flags, those things that can really indicate that more work and more investigation needs to be done, right?
Yeah, so examples of the red flag symptoms would, in the case of women, would be any new breast lumps, any discharge or bleeding from the nipple. In terms of periods, so any change in your period pattern, any irregular or unusual bleeding, and particularly for women who are menopausal, any bleeding after menopause should be investigated as well as generally any weight loss or any blood in the stools or urine. So don't overlook these things.
Right.
In many cases it's not cancer, but we just need to check it out for you.
That's really good to know. So don't feel afraid, just knowing that most times it is really something benign. And if it is, you can go and be relaxed about it instead of worrying about it and wondering.
But the main thing is to definitely get it checked.
That is preventive care at its best, honestly, is being in an environment where you can freely discuss things and not feel worried or judged or afraid.
Yeah, we want to create a safe space for women to come and share any of their concerns, and we can share our knowledge with you to help us find out what's going on, or just to give you the reassurance that you need as well.
There's no silly question.
Definitely. And Dr. Flood, can you tell us a bit more about food as medicine?
And I can even add something to that conversation about breast health when it comes to food as medicine. There's a condition that's common among some women, and Caribbean women in particular, of fibrocystic or fibrodense breast tissue. And that can be brought about by a diet that's too high in sugar and dairy products as well. It makes it harder for the mammogram to reveal what's going on in the breast tissue because things could be sort of hidden behind that density.
That's an important point to mention.
I think that's one of the reasons why there's an emphasis on plant-based diets now as medicine, for food as medicine. A diet that is richer in healthy fats and what we call phytonutrients that are found in our colorful fruits and vegetables. Eat a rainbow of foods.
Yeah, colorful plate is the way to go.
It is the way to go. The rainbow salad is one of my favorites.
Okay, it sounds good as well.
Shredded everything with a color in it.
Yeah. And can you say a bit more about why we should avoid processed foods?
Oh my goodness, yes. Processed food. Sometimes I wonder, have we been too lenient with the term food? In my mind, these are edibles. Processed food. Food should deliver nutrition. That's why we eat. But foods that have had most of their nutritional value removed through over processing of whole grains into white food products, white rice, white bread, white pasta. On occasion, we're always going to have that when you're eating out. It's hard to make a whole food choice. But at home, your home kitchen pantry should reflect your values when it comes to food. So here we really want to have those whole grains. We want unprocessed food the same way that it was produced in nature. Simply picked, washed, packaged, and ready to go. Or fresh out of your garden if you're lucky.
Even better, use the green fingers.
Processed food has so many health disadvantages. It's generally made with unhealthy fats, for example, hydrogenated fats, the kind that cause excess cholesterol accumulations in the blood that can lead to blockages of our vascular system. Processed food is actually often treated with preservatives, colorings, flavorings, and other kinds of chemicals that harm our health and have to be somehow eliminated from our body so that it doesn't cause us even more harm. So this low on nutrition, and they're high on the kinds of things we don't need. What are we talking about? Fast food. That's a top tech term that we really need to just do away with. Just something that's out of the deep fryer all the time or out of the freezer. No, we need that fresh, natural food as much as possible.
Definitely. And just being more mindful when we're out and about, because obviously many Bermudians have very busy lives or have 2 jobs, so it's very easy. It's definitely more convenient when you have a very busy schedule to eat out. But could you say a bit more about how people can meal prep in order to eat more healthy?
Meal prepping is really the key. Not only does it make it easier to have healthy meals when you meal prep, but you can take advantage of food that is on sale or lowered prices for the week. So you really all that is involved is that you buy an abundance of food, take a day or so, and get in your kitchen and go ahead and prep it. Wash it, peel it, if it needs to be shredded or grated, and then package it in some safe containers, some nice glass containers, or some of the green bags that preserve the vegetables and fruit. And you can even freeze food once it's been prepared. If you blanch vegetables first in a little boiling water for a few seconds and sort of pre-cook it, get those enzymes in place, then you can freeze it, and when you thaw it out, it's almost as good as fresh.
Oh, that's very useful to know, actually. It's very useful.
Package it up into portions that could represent your lunch or a quick breakfast, so that we don't have to grab always a muffin or a sweet bread of some kind. If you've made yourself a nice healthy protein and healthy fat and healthy carbs for breakfast in the morning, such as overnight oats, which people love a lot, such as omelets or other kinds of ways that eggs can be prepared, and even plant-based eggs, or even without eggs, soy foods, for examul. Scrambled tofu is an excellent product that a friend of mine recently tried and enjoyed it very much.
She sure did.
That would be Dr. Ansa.
But no, definitely agree with everything that you're saying, and also the importance of having a really colorful plate and lots of whole foods to get those vital nutrients and vitamins that we need, and trying to prioritize a food first approach rather than using supplements. So would you like to just talk a bit more about that?
You're right. It would be lovely if we could get all of the nutrition that we need directly from our food. Unfortunately, sometimes that's a challenge. Why? Because this food is not grown near you all the time, especially here on the island. Much of our food is imported from a faraway place. That means it was picked maybe before it was completely ripe, so it could arrive here and not be spoiled. And as soon as food is picked, it begins to lose its nutritional value slowly over time. Vacuum packaging is one way that sometimes you can find food better preserved without preservatives. However, sometimes supplements are there to bridge the gap between the nutritional products that we need every single day, and there are up to 92 of them, including our phytospectrum nutrients. We need these every day to have optimal health. And sometimes we just cannot get that in our food. What about a person who's on a calorie restricted diet? What about a person who may have had a weight related surgery or a surgical intervention of any kind? the need for nutrition is even greater.
Yeah.
And sometimes people have health conditions that makes it more difficult for them to absorb the nutrition from their food, because we are not what we eat, we are what we absorb. Okay? So in that case, you're going to need to reach for a vitamin or a supplement, such as the Dr. Brown's Lab. We have the multivitamin product in a gummy form or in a tablet form. And in that way, you can be sure that you're meeting your nutritional needs, even when the food or your own food intake or absorption is not on point.
And the multivitamins is a good way to get a lot for your buck, basically.
A lot of bang for your buck in the multivitamin, for sure.
Definitely.
Yeah. On top of that, there may be additional supplements that a person may need specific to their own health concern. And in that case, because we carry such a wide variety of physician's grade non-pharmaceutical vitamins, then you can come and we can assess you through some of our specialized testing to see exactly which nutrients you need. It's another one of our one-stop shop approaches to health.
Exactly. Exactly. To make sure when you come here, you get everything that you need
Under
in a
one
time-efficient way as well. Yeah.
And what I love about that is the cooperation that we have between healthcare providers. So many of us share the same patient.
And we all have the same philosophy of really focusing on improving our lifestyle as well as focusing on managing the medical conditions. So we have an in-house rheumatologist, cardiologist, as well as GPs and yourself as a naturopathic doctor. So we all work together with the same philosophy of maintaining lifestyle to improve your health whilst managing existing issues that exist.
It's been exciting to have our newly onboarded specialist care. It's really been exciting to see how they have impacted our patients' health and expanded our services.
Yeah, just having easy access, quick access to stress tests.
Yes, exactly.
Having a good view of how the heart is working and what can be done to improve the heart function.
For sure. You know, because heart disease used to be more common among men, but now it's quite common among women. And so it's really important to have someone who can do those health assessments. What about when we have our weight loss patients and we want them to go and do vigorous exercise? We want to make sure that your heart is ready for that before we send you out to do that.
Definitely, definitely. As well as knowing how well the heart is functioning and if there's any blockages or changes that may need medication for, but also giving advice on what foods you can eat to try and prevent any further progression of those changes too. So we have everything that you need here to get the checks that you require.
Exactly. Vein Health, our new vein specialist.
Yes.
Because so many women's careers are on their feet, isn't it?
Yeah.
And so women who work standing on their feet all day have a greater predisposition to having these kind of vascular circulation issues, isn't it, in the lower legs?
That's true.
Yeah.
And varicose veins and issues with the veins in the legs is actually quite common here as well. So if you do notice any of those changes, we do have a specialist here that's able to support you with that.
One-stop shop.
One-stop shop indeed.
For healthcare. Dr. Ansa, let's talk a little bit about some of these myths and misconceptions. You had an interesting way I said about the information online, and you said content.
And it's a good point because we have to be really careful about what we consume. There's so much content out there, but not all content's information. So if there's something you're concerned about, it's best to see a medical professional so we can give you evidence-based advice that it's proven to be beneficial. So try not to rely too much on the TikTok warriors out there, but just come to us so we can help address your queries.
I have heard so many versions of a detox. I just can't even.
No, honestly, that's really important. There are some wild ideas out there.
Really wild ideas. One of my least favorites is drinking salt water for better health.
Oh, goodness.
Yes, with no indication that a person that's hypertensive or water retentive should not be drinking salt water under any circumstances.
And I'm sure it doesn't taste great either, but
it doesn't sound like a beverage I would choose.
Exactly. So yeah, definitely would debunk that.
Yeah. How about some of the myths around breast care and mammograms causing harm, Dr. Ansa, or the radiation that's in there. What do you think?
Good point. So, as I said earlier, mammograms use low doses of radiation. And with any test that we do, we always want to weigh up the benefits of the test against any risks. And with mammograms, they use a very low dose of radiation. And the benefits is that it will detect any changes or lumps in the breast that you can't detect, so that we can test further and find out what it is. So I wouldn't be too concerned about the radiation, as it's very low and the test itself is proven to be safe and beneficial for you.
And apparently there's a process now, and I do believe it's available on the island, where the woman can control the compression of the breast.
That's very
tissue.
true. Yeah, it's called patient-assisted compression. So obviously you'll be with the technician, but with certain providers, they have scans where you can be given a remote control and can adjust the compression. Obviously, it needs to be a balance between having good image quality, so you do need some pressure, but you're able to kind of control the amount of pressure you're able to apply, so it's more comfortable for you.
Now, I've heard about thermograms. As a naturopathic doctor, I would venture into alternatives. Now, this is thermography, where heat is used to detect cancerous activity in the breast instead of radiation. It's not the gold standard, and it's not supposed to take the place of a regular mammogram, but it may be helpful for women with fibrocystic dense breast tissue, apparently, to find those areas, those hot spots.
Yeah, and they also have a different form of mammography as well, called 3D mammography for women who have dense breasts. As far as I'm aware, the providers on the islands are quite proactive in, once they've done a scan, if they find that they need more information, they normally arrange a follow-up scan anyway. So they'll take into account your individual needs to get the best quality scan for you.
Bermuda really does have excellent healthcare. Yeah. So tell me again about just the choice that people have in their healthcare. How important it is that people should know that you do have a choice of healthcare.
Yeah, it's very important, because at the end of the day, we're here to serve you. So if you feel that you have a certain query or a certain point isn't being addressed, please feel comfortable to raise that. But we're always here to make sure that your individual concerns and the individual needs that you want to be addressed is focused on. We've moved away from that doctor-centered approach from about 50 years ago, where the doctor comes in and just tells you what to do. It's more collaborative. So we want to know what you think. We know that you Google online. We know that you come in and you already have an idea of what you think is going on, but please feel free to share that, especially if there's any concerns, because then we can use our knowledge and our evidence-based research that we have access to address those concerns, so that you can leave knowing that that's been addressed and you're not going to go home worrying about it. So it is your choice, patient first, and we just want to encourage you to advocate for yourselves, and we work with you.
And I've actually learned a lot from my patients. I don't know everything. And medicine is changing so quickly, it's really hard to keep up. So we remain very open-minded to what the patient may bring. And I will simply use my expertise and my education and training to see how I can steer you in the right direction. Many times I fully approve of what information they brought, a product they found online, or some process or procedure. So we try to really remain open-minded with that patient first, patient choice approach.
Definitely. And if there's information that may not be correct that you've come across, we're also here to kind of give you the more correct information that you should be receiving as well. So it works both ways. We want to also ensure getting the right information, and also we learn from you as well. So
I've heard some doozies.
Oh yeah.
And I don't hesitate to weigh in, because that's my job. My role is not to simply rubber stamp everything that you may find, because it would be unfair to you. I will lead you to the science, and the rest is up to you.
Exactly.
And most people are receptive.
Definitely.
Yeah, once they have a healthcare provider that they trust, they're receptive.
Exactly.
So.
And we're here to empower you to make that decision. We don't make the decision for you unless it's a very critical situation, but we're here to give you the information that you need to make an informed choice for yourself.
We have so many patients who have decided to take an alternative route, and they've had great success. So we're very, very open to that, because naturopathic medicine, holistic medicine, it's real. The products and recommend the evidence-based approach using the correct dosages, the correct product. You know, there's so many forms of magnesium, for example. Some are better indicated for muscle relaxation, others for sleep, others for digestive issues, others for lowering blood pressure. So you've got to have the right product, and that's why we carry such a wide variety of physician grade nutraceuticals.
And we also work together, so many patients want a combination of both. So they want their medications, but they also want supplements or lifestyle advice too, and that's probably the majority of cases.
It really is.
See. So
and they complement one another. For example, persons who are on statins to correct their cholesterol, they very much are in need of CoQ10. They literally go together in the medical research. So we can find ways to make sure that we mitigate that, along with our specialized testing, which can test people for food sensitivities, food allergies, mold exposure, micronutrients or vitamin status. And then you're guided by your own body's what you actually need as a person and not as an overall category.
Exactly. That's a good point to make, which goes back to individualized care as well.
And then our shop in MAC, people may notice a product that they see, and we can bring it in. They could let us know what it is, and we could do our best to find it through our distributors. And we really try to keep our prices in line with people wanting to bring in their own products. Very much in line. By the time they pay the shipping and the duty and the mailing and company, they can find that the products that we have are very, very comparable, and they're backed by science.
Exactly.
Okay, so wow, that was really, really interesting and knowledgeable. Thank you, Dr. Ansa.
Thank you as well.
Need to see
All right, so Dr. Flood, can you tell us a bit more about when women should come to see their doctor?
You know, that annual exam is so important, and I sometimes feel very sad when people have health insurance that they're paying for a month over month, and they're not even coming in just for their standard annual exam. Come in for your annual exam. We don't bite.
Definitely not.
We do not bite. Have that physical, and then go away with a printed report of exactly how you're doing. Have our executive physical, and go away with your heart health, your naturopathic visit, your general annual exam, and we'll see you next year. But suppose you're having an issue of something and it's just been bothering you for so long. Maybe it's something that you might have even spoken to other healthcare providers about, but didn't quite get the answers that you were seeking. Come on in, you're welcome here.
Yes, we agree. And going back to what you said about being a one-stop shop and having access to different specialists and lots of different tests. And we just really want to emphasize that if there's anything you're worried about, don't sit on it. Just come and see us. We're here to look into it for you and to give you the reassurance or the further testing that you need as well.
You know, when people are busy, it's easy to overlook something that's going on with your body. So come in. Haven't you had the experience of talking with a patient and they came in for one thing, but in the course of that conversation, you hear something that really piques your interest and you say, tell me a little bit more about that, and come to find out it's something that actually requires attention.
It can even be more important than the initial person came in
That's
for.
so true. So nothing is too small that doesn't warrant further investigation on your health. It could be that persistent headache. It could be that pain. You know, unfortunately, some cancers don't really cause pain until they're well advanced.
Exactly.
But that annual blood screening would have revealed something that we should go looking for. So come on in and be on the safe side.
Exactly.
Yeah. Dr. Brown's lab product line encompasses something for a lot of areas of health. We have the digestive gummy. I keep that right by my bedside. This is no plug. I keep that product right by my bedside because it is so good at putting out the fire of a little overeating. Guilty.
Easily done.
And it will help me. I get that good night's sleep that I need to get in here and serve everybody the next day. We have the ashwagandha. We have the multivitamin.
We have the CPAC.
The
product is
CPAC
brilliant.
product. Yes, it is. Yes, it is. For colds, flu. We're now entering the winter season once again. People are going to be finding themselves with that tickle in the throat, that malaise and fatigue, signaling that the flu has come around to visit, or just a bad cold. We all need immune support, and that is a product that's specifically designed for that.
And can you touch upon the ingredients it contains, or just general immune supportive supplements?
And exactly, it has the vitamin D3 that everyone came to know during the COVID era as being important for our immune system. It has the vitamin C that's been known for ages to be important for building our immune system. It has the quercetin, which is made from citrus peels, derived from, and then it has the zinc. Zinc interferes with the reproduction life cycle of germs and viruses.
Alongside the probiotics as well.
Alongside the probiotic and prebiotic product that Dr. Brown's lab has, exactly. And all of them are available on Shop in Mac.
And in the clinic as well.
And right here in the clinic as well. Our wide variety of products. So, many people want to see the naturopathic doctor, and they just are wondering, what is it? What is a naturopathic visit? How is it different from a medical visit? One way that it's very different is that it's longer. It's just simply longer. So there's just more time to go into greater detail and to hear the patient out as well. Sometimes I say, so you were born and then what happened? Because healthcare can be a very long story. And things that happened a while back can still be troublesome today. Also in the naturopathic visit, I do a really complete and in-depth assessment of lab reviews, lab work results. And people are always really, really interested to know the why behind these labs and these funny technical names that they see on the piece of paper. Sometimes we can catch things in the early stage for prevention where it hasn't quite crossed the threshold into a disease state. But if we don't intervene, if nothing happens to stop it, it's going to become the disease. So we do that preventive part of care. Talking, listening, a thorough review. I even go through the doctor's notes, Yeah,
definitely. Yes.
To make sure that the person fully understands what the doctor said, what were the takeaways of their visit. And our doctor's notes are really excellent. I must commend you all.
Thank you, and so are yours as well.
Thank you. And so it really just helps to guide the patient towards taking possession of their own health. They understand better. There's nothing more powerful than a patient who understands the why behind their treatment plan.
Because in order to be motivated to implement that treatment plan, you need to understand what's going on. So when you know why, you can then continue once you leave the office.
That is exactly right. Yeah. Once they know that why, boy, a light goes on. They say, "Oh, okay, I get it."
Yeah. But then you see the changes that
you want to see. You want to see. So one-stop shop for healthcare.
Exactly.
So, Dr. Ansa, what is a patient to do? They've sat here patiently and listened to our talk. They've gotten a lot of new information, we hope, some motivation, we hope, to come and see us and take possession of their health care. What next? What's the call to action?
Yeah, so what I would want to encourage is if any woman has a particular issue that they're concerned about, is to book an appointment and we can then explore that issue in more detail. So for example, if you notice a change in your periods, if you come in for a consultation, I can ask more questions about what has happened. Has your period become heavier, irregular, longer? Any change that you've noticed that's been persistent and is affecting your day-to-day life, please let us know, because a lot of women think that heavy periods or painful periods are normal. If your periods are affecting your everyday life, please, that needs to be looked into. It shouldn't be affecting your everyday life. So we're here to dig deeper. So many women may have fibroids or endometriosis, and that can be managed in order for you to live your life more comfortably. There are some women who have had to take days off work, some women who don't even wear white clothing because they're so scared of leaking. That shouldn't be seen as a norm. That should be something that should be encouraged to be looked into. So come and see us if those are anything you can relate to. And also we're here to provide advice and medication for contraception, as well as the screening tests that we mentioned earlier. So we can do the pap smears in-house, as well as referring you for your mammogram. So if you notice any changes of vaginal discharge, any new breast lumps, we're here to look into that as well.
And bring your daughters, isn't it? As I'm listening to you, particularly with the menstrual issues, why not bring the girls in earlier and let's find out if something is going on with them that is manageable. Yeah.
So they don't have to take days off school for their periods. So we're here to help girls and women.
That's old school. So October is the perfect time to prioritize our well-being. It is Women's Health Month. We want to encourage you to book your Well Women, your women's healthcare visit. Also, the naturopathic consultation. We offer a full spectrum of care here under our roof. The screenings, the preventive medicine, the support, and the wellness programs, the weight management. Ladies and gentlemen, let's get in shape before those winter holiday breaks, before those end of year eating festivals come about.
Thanksgiving, Christmas.
They'll be upon us very quickly. So talk, ask questions, make informed choices.
Exactly.
That's what I hear coming from you, Dr. Ansa.
Definitely. And as I always want to say, any issue that you find is an issue is an issue. So
there we are.
It's worth coming in for. No question is silly. No worry is silly as well. So just come in and book if there are any concerns. You can contact our front desk or book online to book an appointment with either of us.
That's right. 293-5476 is our call-in number, and our website, nmac.bm, nmac.bm at 293-5476. We're located right down here on the North Shore Road. We are just west of Dock Hill. And just at the bottom of Glebe Road, we have parking, loads and loads of parking. Often people come and they find our parking lot congested, but they don't know we have parking across the street, free parking. So, we hope to see you there. One-stop shop healthcare.
Indeed, and patient choice, patient first.
Thank you. We'll see you next time, and maybe in one of our 1-minute health blurbs that are coming up soon. You'll be joining us on some of our platforms to see us just give a quick little insight into one or another health topic.
Exactly. And we also hope to see you in-house in the clinic as well when you book your appointment.
Absolutely.
Bye.
Bye.